Morning everyone. Today is another beautiful day and I was about going home and I decided to do some little overview on the skeletal system. So we are going to talk about the musculoskeletal system, the overview of musculoskeletal system and this musculoskeletal system, we want to divide the word into two: musculoskeletal. Then there is going to be muscles and skeleton. So we're going to pick skeleton first and talk what skeleton is all about before looking at the muscles. So in this video, we are going to only focus on the axial skeleton, and this is the skeleton. You can see this is the skeleton, and anatomically, to differentiate whether this is a male skeleton or female skeleton, first of all, you have to look at the cossi, because the male skeleton, the cossi are always anteriorly, while female cossi is posteriorly. This is the cossi. Something back like this, that is the cossi. So, and the skeleton is a bony framework of the body, and it's 206 in number. It is 206 in number, and it protects the body, the visceral organs, gives support, aids in movement. That is the function of the skeleton. But today we are going to only focus on one of the type of the skeleton, or one of the division of the skeletal system, which is the axial skeleton. The axial skeleton, you have two divisions. You have the axial skeleton and a perpendicular skeleton. But today I'm going to look at the axial skeleton. This axial skeleton, they are not detachable. You understand? They are just threads. Just like they comprises the skull and the vertebral column. This is the skull, and this is the vertebral column. This is not like this is the vertebral column. And this vertebral column houses the ribs and the sternum. It houses the rib and the sternum. So this skull and the vertebral column are the axial skeleton, and they protect the brain. They houses the brain and also protect the thorax. Every organ inside the thorax, like the heart, that's what they protect. So we are going to look at these two organs, these two bones, the skull and the vertebral column. But before that, I have five classes of the bone. We have the long bone, the short bone, the irregular bone, the sesamoid bones, and the flat bone. The long bone are the femur. The femur is the long bone. The humerus is the long bone. The tibia and ulna, all these are the long bones. We have the short bone like the metacarpals and the phalanges and the tarsal bones. All are the short bone. We also have the flat bone, like the skull is a flat bone. We have the small bone, which are the patella, is one of the bones of the sesamoid. We have the irregular bone, like the vertebra, is irregular bones. So these are the classes of bone. Then let's look at the skull and talk what skull is all about. The skull is a very vital organ because it houses and protects the brains. And the skull, we have 22 bones of the skull. Basically we have 80 bones of the axial skeleton, but in the skull we have 22 bones of the skull. This skull only have only 22 bones. We have 8 cranial bone and 14 facial bones. 8 cranial bone and 14 facial. If I remove my distance, this is a cranial bone. The bone here is the facial bone. So the cap, if I remove this cap up here, we call it calvary. We can call it scalp, just like a lady tying her scalp. You understand what I'm saying? So it's called it calvary, or you can call it scalp. So we have 8 cranial bones, and those cranial bones are the temporal bone. You have the temporal bone that are located here. You have the temporal bone. You have the frontal bone. You have the occipital bones. You understand? Frontal bone, occipital bone, temporal bones. That's what I'm saying. You have the ethmoidal bone and also have the sphenoid bone. The sphenoid bone is the butterfly-shaped bone inside the skull, because when you open the skull, you have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The sphenoid bone is sitting at the center. It's sitting at the center. That is the sphenoid bone. And the facial bones are 22 in number. No, the cranial bones are the facial bone 14 in number. We have the mandible, the mandala, the nasal, the zygomatic, the patella, the palatine. We have the concave and have the vomer. Those are the facial bones. Looking at about the thorax, So that this vertebral column, you have the cervical bone. Let me turn so that you see what I'm talking about. If you look at this skeleton like this, this bone here is the cervical, is the vertebral column. The bone here is a cervical bone, and there are 7 in number. We have thorax, which are 12 in number. We have the lumbar, which are 5 in number. We have the sacrum, which are 5 in number. We have the coccyx. This is the coccyx, which are 4 fused to 1. These are the bones of the vertebra. Bones of the vertebra. And this coccyx in the men, it is anteriorly, it's going inside, but in female, it is going backward. That is posteriorly. And looking at this, these are the bones. We'll now talk about the bones of the thorax, which are the ribs bones and the breastbone, which is the mandible, this thing. Or looking at it, you said this is the sternal bone. And this sternal bone has 3 divisions. Actually, it has 3 divisions. It has the mandible, you have the body, and the xiphoid process. And this xiphoid process, you can notice it when somebody is old. It has to go inside anteriorly. So this 3 division of the sternal bone and the mandible, the body, and the xiphoid process. And there's an angle here called the sternal angle. We call it angle of Lewis. It's a very important landmark in anatomy, actually. So you have ribs. Basically, you have 12 ribs. You have the 4th ribs, the floating ribs, and the true ribs. The true ribs are the ribs that is attached directly it attached posteriorly to the vertebral column, and they attach anteriorly to the sternum. You understand? So there are true ribs. You have 1 to 7 are true ribs. Then 8 to 10 are false ribs. The false ribs attach to the true ribs, while the floating ribs are 11 to 12. They do not attach anywhere. They are floating. Basically, I don't even know their function in the body, but they are floating ribs. So you have true ribs, false ribs, and floating ribs. 1 to 7 are true ribs. They are attached posteriorly to the vertebra and anteriorly to the sternum. And this sternum, remember, this sternum has 3 divisions: the mandible, the body, and the xiphoid process. Then you have false ribs attached to the true ribs, while you have floating ribs. The floating ribs do not attach anywhere. They are just floating. And the true ribs are 1 to 7. The false ribs are 8 to 10, while the floating ribs are 11 to 12. We also have regular and irregular, typical and atypical ribs. The typical ribs has common features, and they are 3 to 9, while the atypical ribs has different features, and 1, 2, 10, 11, 12. Those ones are atypical ribs. So basically, let me just summarize what I've said. I said I have skeleton at the bony framework of the body, and it has 2 types, and we have axial skeleton and a perpendicular skeleton. The one you can detach are the perpendicular skeleton, but the one you can't detach, like this one is a perpendicular because it detaches from the body. So this is a perpendicular skeleton. But the one you cannot detach are the axial skeleton, which comprises the skull and the vertebral column. It comprises the skull and the vertebral column. And we said I have classes of bone. We have long bone, short bone, irregular bone, sesamoid bone, flat bones, and so on and so forth. So we'll now say that this axial skeleton you are seeing comprises the skull and the vertebral column. And the skull, we have 22 bones of the skull. We have 8 cranial bone and 14 facial bones. I've mentioned it. We have the occipital, the frontal, the temporal, the sphenoid, and the ethmoidal bones. We also have the facial bones. These bones here are the facial bones, and they are 14 in number. Then I also told you about the vertebral column. And the vertebral column, you have the cervical. The cervical is the neck. That's the neck. You have 7 cervical bone, 12 thoracic bone, 5 lumbar, 5 sacrum, and 4 fused bone, which is the coccygeal bone. And this coccygeal bone is very important to demarcate, to differentiate whether the skeleton is the male or female. We will now pick the cervical, the thorax, and the thorax consists of 12 ribs because it's 12 bones, so it consists of 12 ribs. And the ribs are very, very important because they houses a visceral organ, which is the heart. So these ribs, you have three types of ribs. You have the forked ribs, the true ribs, and the floating ribs. The true ribs are the one that attach directly to the sternum and not directly to the sternum posteriorly. This anteriorly, this is sternum. It attaches directly to the sternum anteriorly. Then attach to the vertebra posteriorly. That is the true ribs. And then number 1 to 12, number 1 to 7, that 1 to 7, that is the true ribs. They attach. But the first ribs does not attach them, they attach directly to the true ribs. And they are 8 to 10, that is the first ribs. They will now have floating ribs. These two ribs here are floating ribs. They do not attach anywhere. They are called floating ribs. We now have typical and atypical ribs. The typical ribs has the same features and they are 3 to 9, while atypical ribs has different features and they are 1 to 10, 11, 12. Thank you so much, and make sure you follow us for, we are going to talk more on the appendicular skeleton, the one that is detachable, like the femur, the upper limb, the lower limb, the pubics, which is the basin shaped organ that houses urogenital organs like the urinary bladder, and so on and so forth. Thank you.